in understanding how the relief of back pain and shoulder pain occurs after a breast reduction, let me give you a little analogy that a sailboat has a mast, and there are sails in front and in back of that mast, and an experienced sailor knows how to turn those sails so that the wind blowing into the sails will be balanced by the other one, so that the mast of the ship won't keel over and the boat won't sink. So the same is true of your spinal column. Your spinal column, you want it to be straight up so that you have good posture, and because of the weight of excessively large breasts, which is the front sail, the patient would normally be inclined to lean forward because of that extra 6, 7, 8, 9, 10 pounds of weight. And in order to have enough wind in the other sail, those are your back and shoulder muscles that need to be constantly in a state of contraction or spasm in order to keep your spine straight. So the reason I mention this is just as an analogy to how breast reduction gets rid of the weight in the front of your breast. Something very interesting that I notice almost every time in the recovery room, when a patient gets up to go to the bathroom just before discharge, because the weight in the front is no longer there, when she stands up the first time, those muscles are still by memory in spasm, and she'll actually feel like she's falling backward, and it's very quick. It goes away almost instantly, but it's a neat thing to see because it is the body's way of saying, okay, we needed to always keep you standing up straight, but now we don't need to be in spasm anymore because that weight in the front is gone. And sure enough, back pain, shoulder pain, and posture are improved almost immediately.